My name is Patricia, and I'll be speaking to you today about disparities and how they are related to HIV and AIDS prevention and treatment. Okay, and a few key objectives that we're going to go today is to understand the difference between a health disparity and a health care disparity, and how these disparities affect HIV and AIDS treatment, and how can we work towards controlling those inequalities. So in my recent studies, I found that last year, almost $93 billion were spent on excess or unnecessary healthcare costs. Why? Because people of different statuses, genders, and sexual orientations, they face unequal medical care, treatments, and costs. So what's the difference between a health disparity and a health care disparity? A health disparity is a higher burden of medical issues experienced in one group versus another. And a health care disparity refers to gaps or differences between these groups in insurance coverages and access to quality and affordable health care. There are many different factors that affect the AIDS-related health care, and some that even discourage people from getting tested and learning how to prevent and treat AIDS. So here's a list of some of those factors of why disparities may exist, and it's all not just because of the healthcare system. We can also see that it comes from like education and your environment and your community and economic reasons. So in 2016, the CDC's data showed that Black men in same-sex relations have the highest number of new HIV infections that were reported. And if you go down the line, you can see that Latino heterosexual women were at the lowest. So there are over 1 million people in the United States that are living with AIDS, and about 15% of those people don't even know they have it. So there are two key initiatives that aim to control disparities in the U.S., and one is the Affordable Care Act, which reduced uninsured rates for low-income households. And then we also have the 2011 Department of Health and Human Services Disparities Action Plan. And this plan was to set a course of action that would set up a disparity-free nation. So what can we do to be a part of the continued efforts to reduce healthcare disparities? We can get with our state officials in our local communities and get educated on what we can do about getting insured and not being a part of the disparities, not being faced with those healthcare costs, and see how we can get around those barriers. So, in conclusion, we should just go get checkups, encourage our family members to go get annual checkups, and our friends to do the same. And if you want help with finding affordable health care, they do have services in our communities, like the Health and Human Services Commission that help with getting Medicaid or even low-cost state insurance to help get you covered. Just go to the doctor, you guys, and get treated, and just practice healthy healthcare habits. Thank you.